Hello dear friend, this video is dedicated to the topic of pregnancy, in particular the hormone of pregnancy, HCG. If you're interested in this topic, watch this video. I'm Dr. Olena Berezovska and I'm glad to see you on my YouTube channel. I said in another video that there is a method for diagnosing pregnancy, determine the level of HCG. In this video, I will talk about the different types of HCG and HCG doubling phenomena that many women have heard about. Is it necessary to determine the level of HCG in pregnant women? How to interpret the obtained results? I have already mentioned that there are alpha and beta HCG or other subunits of this hormone. Most often we determine the level of this hormone in thousands of international units in 1 milliliter of blood or urine, merely international units per milliliter. In other countries, hormone indicators may be in other units of measurement. HCG can be detected in the blood as early as 7-8 days after conception when implantation begins. Approximately it will be 21-23 days of the cycle at 28-day cycle. If the cycle is longer or shorter, HCG level may appear on other days. HCG can be detected in the urine 8-9 days after conception or 2-3 days later than in the blood. This is when pregnancy test may be positive. The HCG level rises until 10-12 weeks of pregnancy, so we do not measure the level of this hormone at 16-19 weeks to confirm pregnancy or for any other purposes. From 12 weeks, the HCG level decreases and reaches the level of 6 weeks. Also, there are occasional fluctuation in levels. If you look at the HCG references values, you will notice that they have a large range between the minimum and maximum values. The level of the hormone can be several hundred or several thousand units in the same period of pregnancy, and even more so in different women. Therefore, we never determine the gestational age by the level of HCG. The first 4 weeks of pregnancy, actually the first 2 weeks after conception, HCG rises very quickly. It doubles every 2 days. To be scientifically accurate, a doubling of HCG levels occurs every 2.2 plus minus 0.8 days. In 80% of women, doubling HCG can take 48-72 hours. What does this mean? Doubling may take a little more or little less than 2 days. Therefore, doubling the level of the hormone is not a clear indicator of the progress of pregnancy, much less a prognostic criterion. For us, doctors, it is important that there is an increase in the level of HCG, and it is not too slow. If we see good HCG level, this is more in favor of a progressing pregnancy. After 6-8 weeks of pregnancy, the growth of HCG slows down. It can double every 3.5-4 days. Therefore, usually after 6 weeks, we do not determine the level of HCG to make sure that the pregnancy is progressing. If we need to know if the pregnancy is progressing, we perform an ultrasound scan, look at the condition of the embryo, whether it has a heartbeat. If there are any abnormalities in the embryo or gestational sac, we can check the HCG level to make sure the pregnancy is progressing or regressing. But the test must be done several times during the week. Therefore, it is easy to reduce the ultrasound in a week. By itself, HCG will not tell us much without comparison with ultrasound data. A decrease in HCG after 10 weeks characterizes the moment when the placenta begins to fulfill its function fully. Interestingly, at 6-8 weeks, a luteal-placental shift is observed when the placenta becomes the main source of progesterone. As soon as placental progesterone rises, HCG begins to drop. There is also a hypothesis that HCG does not support the function of the corpus luteum. Its rising level, on the contrary, suppresses the production of progesterone by the corpus luteum, because by 7-8 weeks of pregnancy, the ovaries become inert, the corpus luteum stops its function while HCG is still growing significantly. Again, I repeat, we do not determine the gestational age by the level of HCG. Also, by the level of HCG, we cannot determine the localization of the gestational sac in the uterus or outside the uterus. In the very early stages of pregnancy, when the level of HCG is not high, we may not see the embryo in the uterus, which is the norm. Yes, conception could occur later and not on the day when the woman thought she was ovulating. If there is any doubt, we observe the woman in dynamics for several days. In what cases do we determine the level of HCG? First of all, to confirm or not pregnancy. HCG is not always produced during pregnancy, but beta HCG is characteristic of pregnancy. We can determine the level of HCG several times to confirm the progress or regression of pregnancy, most often for the choice of tactics of action. We measure HCG levels after the pregnancy is over to make sure the pregnancy is terminated and the gestational egg has left the uterus. In other words, there is no products of conception left. HCG levels are important in diagnosing pathological pregnancies such as gestational trophoblastic disease or mole pregnancies. I will cover this in another video. The high level of HCG in this pathological pregnancy must be controlled after its completion for a certain period. HCG is part of prenatal genetic screening, but it is not its quantitative indicators that are important, but relative ones. I will also talk about this in another video. False positive results occurs in up to 1% of cases, often in the presence of different types of antibodies. In workers of farm, zoos, veterinary clinics, it also depends on the level of luteotropic hormone, rheumatoid factor, and other antibodies. Sometimes they determine the level of HCG in the urine since its amount in it is extremely small. False negative results are most often due to errors in the laboratory tests. Thus, HCG plays an important role, which I will talk about in my new videos. I recommend that you do not rush to get tested and looked for HCG. If you want to know if you're pregnant or not, wait until your periods is late, take a pregnancy test, and monitor your condition. Your hustle and bustle can create unnecessary stress and harm your pregnancy. Remember, a healthy pregnancy does not require aggressive intervention and aggressive supervision. A healthy pregnancy requires your patience. If you experience spotting and/or pain, then you should contact your doctor or midwife to rule out an ectopic pregnancy in the first place. We will continue the theme of pregnancy in other videos. If you like this video, don't forget to like, subscribe to my channel, invite your friends and family, and see you soon.